Now, developing news from KXAN News.
An Ebola case confirmed here in Texas. How doctors are handling the case and what you need to know about this risk.
As we mentioned, the first diagnosed case of Ebola in the United States is right here in Texas.
The patient is a man who lives in Dallas, but the testing done to confirm the positive result happened at the State Health Lab here in Austin. The Centers for Disease Control made the announcement within the last 30 minutes. Officials at Texas Health Presbyterian Hospital in Dallas say the unidentified man who had recently traveled to Liberia in West Africa is being kept in isolation. Presbyterian Hospital officials also say they are following CDC recommendations to keep doctors, staff, and patients safe and making sure no one else is infected.
We identify all people who may have had contact with the patient while he could have been infectious. And remember, Ebola does not spread from someone who's not infectious.
Anyone who came in contact with the infected man will be monitored for 21 days to see if they develop a fever and could possibly be infected. The CDC says people should not be concerned about Ebola spreading further as a result of this case.
The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country.
Health officials say the person receiving treatment did not develop symptoms during travel, but became symptomatic once arriving back home. And that is good news because that decreases the possible threat to the general population because this person was not contagious while traveling.
Again, the testing done to confirm the positive result happened here in Austin. KXAN's Amanda Brandeis live at the State Health Lab with those details. Amanda?
Well, right now we're at 49th Street near Lamar at the Texas Department of State Health Services and can confirm that that positive Ebola test was done here. We've learned that it arrived at 9 in the morning and that positive confirmation came at 1:22. We've also learned that this lab only became certified to do this Ebola testing about a month ago. Now, right now, we're trying to figure out what happens with the specimen next. We're not sure if it's been discarded, and if not, does it stay here or does it go somewhere else? We are working to gather those details for you, and we'll bring you the latest tonight at 6. Reporting live in Austin, Amanda Brandeis, KXAN News.
All right, Amanda, thank you very much. And looking closer now.
Joining us now, Dr. Jay Bernhardt. He's a professor and founding director of the Center for Health Communication at UT Austin and former head of communication at the CDC.
So Dr. Bernhardt knows very much about what's been going on at the CDC today. Very busy there. We know. Talk to us a little bit about what is being done to contain this one case.
Sure. And let me start by saying that we certainly feel for the case and the patient, and that our hearts and feelings and prayers go out for him and his family. The CDC certainly expected that this could happen, and those people in the public health community knew that it was possible that someone could end up in the United States with this infection of Ebola, hemorrhagic fever. What they're doing right now, of course, is springing to action, and they've been planning for this. They're, of course, have the patient in isolation at the hospital, and they've been prepared for this. They've been certified, in fact, to care for a patient with Ebola. They're working in the community to find out who he might have been exposed to in recent days when he may have been infectious. And if they find any potential cases, they will very quickly isolate those as well. But one of the most important things that all of us could do is to take a deep breath. Because while this is scary and Ebola is certainly a very dangerous and often deadly disease, we know that it will not, it's very unlikely to spread widely in the U.S. There are controls in place by the CDC, by the state of Texas, and by many other organizations working in response to make sure that doesn't happen.
What is the danger for the news media to hype this too much?
Well, I think the news media have an important role to play. I mean, I think it's terrific that you're getting this message out to the public that this exists, that this is in place here in Texas, but also that we're not at risk. We can go home to our families and we can go to work tomorrow, and this is not something that we're at high risk for. But what we do need to do, in fact, to help prevent this from happening again, is to pay more attention and devote more energy to helping prevent the spread of Ebola in West Africa, where it truly is an epidemic.
Dr. Jay Bernhardt from UT Austin, we appreciate your views for coming in today, too. Thank you so much.
Thank you very much.
The Centers for Disease Control is taking a key role in the fight against Ebola in Africa and the effort to keep cases from spreading to the United States. The CDC has more than 100 disease detectives on the ground in West Africa now. It is also working with airlines and airports to prevent sick travelers from getting on planes and potentially carrying Ebola to other countries. They are tracking existing cases and helping doctors improve their infection control practices to stop the spread of the outbreak.